come forward for the presentation? Thank you. Please note that the presentation will be virtual, hybrid. It will be online. So, and then from there on, we shall go forward with the other parts of our meeting, which is deliberation on the presentation. I thank you. Hello.
Hello.
Good afternoon.
Good afternoon.
Mr. Gabriele, how are you?
Good, good.
Okay, great, great. I just wanted to know whether you can hear us all or view us all here.
Yes, I can review. I'm trying to share my screen.
Thank you so much. Please, you can go ahead. Thank you.
Can you view my screen?
Yes, we can.
Okay.
And we can hear you loud and clear.
Okay, thank you very much. Good afternoon, everyone. Dear Vice Chair, Honorable member of SADC PF, good afternoon, bon après-midi. It is my pleasure to share with you the findings that we have been able to gather from across the region, the East and
Hello,
South.
Mr. Gabriele.
Yes.
Can you put your slides on slide presentation? Because we cannot see the screen. It's not that big for us to see, to view.
Can you see it now?
If you can press the computer sign at the bottom of the screen, just press that so that we can see full screen.
Yeah.
The icon that looks like a television. Yes, thank you.
Can you view it now?
Yes,
thank
better.
you.
Thank you.
Okay. Thank you very much. So my name is Mathias Gakwerere. I'm a humanitarian technical specialist at UNFPA Regional Office for East and Southern Africa. So it is my privilege and honor to share with you the findings that we have been able to gather while conducting the minimum initial service package readiness assessment across the region. So this is an assessment that we have been able to conduct over the year 2022. And we are going to share this so that we understand how it speaks to the resilience, the preparedness that is needed to build the resilience and ensure that we can respond to emergencies and ensure that sexual reproductive health and rights services are issues are addressed in our response. So at the end of this presentation, we are going to reflect and if the country, every country of the SADC region is ready to implement the minimal initial service package for sexual reproductive health and rights. So for the sake of those who might not be conversant with this concept of MISP, allow me to take a couple of slides to explain a little bit what is the MISP. So MISP is MISP for sexual reproductive health is a priority set of activities that should be implemented at the onset of every humanitarian crisis. So it forms a starting point for programming in humanitarian emergencies, and it should be sustained when the crisis is over. It should be sustained and integrated into the comprehensive sexual reproductive health throughout protracted crisis and recovery. So we are looking here at integrating these minimal services into the broader health system and ensure that we don't offer only the minimum services, but also we move toward the comprehensive sexual reproductive health services. So we have 6 objectives of this minimal initial service package for SRHR, which include the first objective is to ensure that when an emergency occurs, we have a proper coordination mechanism. We have someone to lead and coordinate this response. Secondly, we need to prevent sexual violence and attend or address the need of survivors. We need also to prevent and reduce morbidity and mortality due to HIV and the other sexual transmittable diseases. Objective number 4, we need to prevent excess maternal and neonatal morbidity and mortality. So this is because be it in a development context or emergencies, there will be always some maternal mortality and morbidity, but during emergencies, we experience an excess of this maternal mortality and morbidity. That's why we want to prevent that excess of preventable maternal morbidity and mortality. Objective number 5, we want to prevent unintended pregnancies. Objective number 6, we want to plan for comprehensive sexual reproductive health so that we integrate the minimum package into the primary health care as soon as possible. So those are a set of 6 objectives of MISP. But on top of that, we need to ensure that we provide safe abortion services to the full extent of the law so that we can provide this with quality in health centers and hospitals. So briefly, these are a description of what we call or what we mean by MISP. So the next slide, we are going to see what is minimum initial service readiness assessment. So the MRA or minimum MISP readiness assessment is a tool which helps us to have a snapshot of national MISP readiness. So it provides a snapshot of the readiness or capacity to ensure that we have access to essential SRHR services when emergencies occur. So beside providing that snapshot, this helps also to initiate preparedness. It is a process for SRHR preparedness. It helps to enhance preparedness. So it is a starting point for structured and targeted SRHR preparedness work. So it helps also to identify key areas that need further investment in terms of SRHR. So this assessment is always done by a multi-stakeholder process. So it requires multi-agency collaboration, including government, CSOs, UN agencies, community-based organization, private sector, among others. So while implementing the SRHR, this readiness assessment, what we did, you have to deploy a questionnaire, and you have deployed a questionnaire across all the member states of the East and Southern Africa, so that through that collaboration and consultative process, we identify strengths and weakness and understand the context vis-a-vis to MISP readiness in that particular country. So after that one, we moved to prioritized action plan. Each country, they came together and discussed action plan to address the gaps that have been identified in MISP preparedness. So I'm going to share with you a couple of slides to discuss some of the results and trends that we have been able to realize in the region. So as I explained earlier, this has been a multi-stakeholder approach. We had in total 383 different partners involved, including government, UN agencies, and other partners. So these are the tools that we used. This slide, I will not dwell on it because it provides only details about the questionnaire and the objective addressed. So I will spare this for you. And then I'm going to explain the strengths, what we have been able to see in terms of the policy environment in the region. So the strengths that we have been able to document is that there is existence of a national emergency policy across many majority of countries in the region. There is existence of national health preparedness and response plan. There is existence of coordination mechanism for disaster management, and there is existence of warehouse and storage facility. So at policy level, we have those policies which talks about emergencies. The SRHR policies are there. But as a weakness, we realize that there are lack of supportive legislative environment that support especially SRH in emergencies. In addition, there is coordination mechanism which are rarely focusing on preparedness issue, but are rather reactive, covering emergencies. So there are rare coordination mechanisms which look after preparedness in general, including sexual reproductive health. There is a lack of comprehensive SRH specific data collection tool in emergencies, and there is a lack of resources earmarked for SRHR. So regarding the policy landscape, as we said, as you see, for national emergency policies, we see that we have a quite good number of countries who have that national emergency policy, national health preparedness response plans are in place. But when it comes to SRHR and MISP being integrated into those policies, you see that we have a big number of countries, 13 countries out of 22 countries in East and Southern African region reported no, they don't have this integrated. SRH policy that include disaster response management. So you see a quite number, 18 countries, and SRH in recovery plans. 14 countries out of 22 reported that they don't have SRH integrated in recovery plan. So you will realize that this really is a gap, which is at policy level, and we think that the parliamentarian of SADC can play a big advocacy role to ensure that the Ministry of Health, Ministry of Disaster Management integrate those aspects of SRHR and MISP into these emergency plans and SRH policies. Regarding coordination mechanism, we can see that SRH, national SRH coordination exists in roughly half in countries in recovery, But when it comes to preparedness, most of the country don't have this SRH coordination. When it comes to response, this coordination increases. At subnational level, you will see also how the picture look like. So we have issue in integration of SRHR and MISP into policies, but also we have issues when it comes to having strong coordination mechanism already working or functioning during the preparedness and recovery phases. So regarding enabling environment for MISP provision, now we go a little bit downstream to look at how the MISP, how the health system is prepared to provide MISP. So we see that some of the strengths that we can mention is that we have the availability of personal protection equipment and infection prevention control materials, and there were availability of communication channel to inform population in case of emergencies, and there was existing of free health services for crisis affected population. This was part of the strengths, but the weakness in most of countries, access to services for marginalized and underserved groups of population was an issue. This include people living with disability and other marginalized group of population. The integration of MISP in healthcare training curriculum was also mentioned as an issue, and also availability of system to provide remote service delivery when there is emergencies like the COVID-19 pandemic, when we could realize access issues due to restrictive measures of movements and lockdowns. So we need to have this capability of having remote service delivery, and these are still not available enough in our region. So this is a graph that shows how these elements stand in the region vis-a-vis against each MISP objectives. I think here you see also that the gap, those who said no, the country who reported no are quite significant. So we still have lack of confidential and safe space within the health facility. We still have poor availability of supply and commodity for clean delivery and immediate newborn care. We still have a lack of inadequate information education materials, which are translated in different languages accessible for people with disabilities. So ability to provide MISP services, here we are looking at the health facility, the staff and equipment. So in this, we see that most of the respondents responded that they have insufficient capacity to provide MISP services. And you will see in yellow that is insufficient is in red. In yellow, it is minimum needed. They can only address at a minimum level. And then this green is when they can manage fully all the MISP services, when they can provide. So you see here also, in terms of service delivery, we still have issues across the region. So some of the challenges that we faced during this exercise, of course, this was a consensus-based exercise. So to agree on rating on some of the questions were not an easy exercise. We had also a sensitive discussion around abortion in some of the countries where they were not open to discuss on abortion services. And also we had difficulties to fund the action plans. So as the UNFPA and the Together for SRHR. This is an initiative that we are together with WHO, UNICEF, and UNAIDS. We have been able to support 5 countries only to implement their action plan as a catalytic fund, but all countries developed the action plans to implement the MISP readiness assessment recommendations. So funding for those action plans have been quite an issue. So some of the lessons learned from the process is that the MISP readiness assessment process provided an opportunity for capacity building on MISP and SRHR in emergencies for the country team. It was a capacity building opportunity. Secondly, it helps to understand the national emergencies and preparedness policy landscape across the East and Southern African region. And it created an advocacy agenda toward SRHR emergencies. So it was really an opportunity to bring all the actors together and advocate for SRHR in emergencies, share evidence around why do we need to have SRHR on the table during emergencies. So it has been an opportunity to create a strong collaboration platform between health and disaster management authorities. So in some instances, we could see that the collaboration between health, Ministry of Health, and the Ministry of Disaster Management and Response was not quite strong. And this has provided an opportunity really to tighten up this, to enhance this collaboration. And finally, and most importantly, it highlighted the need to work across the humanitarian development nexus. Because if we prepare enough, we end up having a very smooth response. And this is very important, especially in our region, where we have natural disaster coming every single year. So we need to get prepared so that and really ensure system resilience, leaving no one behind, and also having in a vision to strengthen or enhance humanitarian development nexus. So these are some country examples. Let me pick some example from SADC region. Like in Lesotho, we have realized that the Disaster Management Authority is open to consider SRHR and to better operationalize their health desk. And during the implementation of the recommendation in Lesotho, we have been able to support the integration of some SRHR indicator into vulnerability assessment tools to make sure that they are ready, the preparedness caters for SRHR and MISP. For Angola, for example, the action plan was approved by the Executive Secretariat of the National Commission of Civil Protection. And in Tanzania, the process helped initiate a conversation and partnership with Disaster Management Department to see how the MISP can be integrated into their policies. And finally, in DRC, the involvement of Ministry of Humanitarian Affairs helped raise awareness on the MISP. So those were the few examples of how we saw this collaboration really coming strongly across the countries of SADC. And these are the key recommendations. So we need to advocate for the integration of MISP into national emergencies, preparedness, recovery, and DRR policy and plan, disaster response policies and plans. And here really we look, we see parliamentarians playing a critical role in this advocacy. We need to advocate for the inclusion of disaster management and emergency response into sexual reproductive health development policies. And also at this point, we see parliamentarian playing a critical role. We need to advocate for the inclusion of MISP into national midwifery, nursing, and doctors' curriculum. We need to mobilize resources for implementation of the action plans. We need to use MRA results, MISP readiness assessment results, to inform and further strengthen the region and international commitments. And also we need to encourage cross-country learning and sharing of good practice. So in this regards, we are holding quarterly meeting to learn from each other, where we gather all the countries of the region, East and Southern Africa, so that we exchange knowledge, best practice, lesson learned throughout the implementation of the action plans post-MRA. So I will end by quoting one of the participants who said that for more than 2 decades, humanitarian workers have been working, doing need assessment each year, coupled with the humanitarian response plan, thus limiting themselves to the acute and post-acute phase of the crisis. So the challenge is to deviate from this rule and to act before the crisis and focus on preparedness and what it implies, namely the prevention and mitigation of risks. This is a quote from one of the participants from DRC who really contributed strongly with this statement. So this really highlights how preparedness is very key and how we should make sure that we advocate to ensure that the SRHR issues are integrated throughout the preparedness, so that we ensure that when the crisis occur, the SRHR need of women and girls are catered for and fully addressed. Thank you very much for your kind attention. And I hand over to you, Chair, and open to receive question or contribution or comments. Thank you, over to you.
Thank you so much, Mr. Gabriel, for the presentation that has been an eye-opener for us of the region. And at the same time, I shall open the floor for discussion. But before that, we shall give a round of applause for Mr. Gabriel for his wonderful presentation. So, Mr. Gabriel, now I shall open. Thank you so much. I shall open the floor for discussions or questions that we shall put forward to you following the discussion by the floor. Thank you so much. Thank you.
Thank you.
May I now open the floor by the raise of hands so that we can. Sorry, members of the committee, it has been I think it has been an eye-opener for us all, especially the methodology that the assessment has been done in regards to the minimum initial service package for, that is the MISP, for sexual reproductive health in climate change, whenever there's any issues in relation that our constituents cannot reach the main health facilities. So we have heard the discussions, the presentation about the methodology and especially the results of the assessments and in particular the strengths, but at least we can work, I think of the presentation that has been very consistent in relations to the weaknesses that has been laid ahead of us. And I now open the floor for discussions and so that Mr. Gabebiri can provide us with possible answers to our questions. And we can even provide recommendations based on our country's initial participation, so availability of the service, so that we can share amongst ourselves, especially for those that have more weaknesses or challenges to implement the such service for the people of our countries. Thank you so much.
Thank you, Chair. Let me begin by thanking the presenter. Indeed, it is an eye-opener. And many a times, I think you will agree with me that when you are hit by a disaster, which needs your action immediately, you are found wanting, you are running all over. And most of the plans that we do have, they may have worked at some time. But sometimes I think we also lack review of the policies or plans that will be there already, but because you have not applied them for a while. I speak with reference, for example, Zimbabwe, we had a cyclone Idai. That's a policy which we have, I would say, in the Ministry of Local Government, but we were also overwhelmed. So I speak with experience and evidence where we had to go to the rural areas to assist communities. I liked when he mentioned on the weaknesses, where the access to services by marginalized communities is overwhelmed by those that are undeserving. You will find in terms of drought where you want to reach out to communities, those who can actually afford or do have also jump the queue or the access in terms of getting priority. So that is a reality. So I think we need also to target this and have a data collection in terms of the communities that are supposed to be benefiting, be it to the young girls, be it to the young boys. I speak with reference to sexual reproductive health rights in terms of our sanitary wear, which we can be giving in schools. But if we do not have the data in areas, we end up offering services to the undeserving, a wrong target group. So my recommendation is we should have our work plans that are in existence already to be reviewed and to monitor on whether they have been effective enough come another disaster. Number two is actually to establish data systems where you have, at the click of a button, which province, which district and where to reach out. The next one is awareness raising in communities themselves, so that they know who is supposed to be benefiting. They know themselves because they are the ones that are affected. In that way, you will not actually pour resources unnecessarily to undeserving populations, and you miss the target in terms of those that you would want to assist. I think I liked when he actually talked about the resources, because many times we run the risk of not actually even putting aside something or disaster management plans. Because if a plan is there and it's not budgeted for, how then do you achieve the results you want? So I think when we do have disaster management plans, they should also be accompanied by adequate budgeting, where we can, as a nation, before we even reach out to our neighboring communities. Especially, you see now, the SADC is actually affected by floods, it's affected by drought. We may all have the same problem, where John cannot assist Jack, or Jane cannot assist Jill. Thank you, Madam Chair.
Thank you so much for the deliberation. I think they were mostly comments, but probably for the, we can, Mr. Gaberere, are you still with us?
Yes, I'm with you.
Okay, thank you. I presume you have heard, but mostly for the, for management of the services, the MISP, it's essential for us to have a costed plan and costed development plan, so that provided with evidence, meaning that data, disaggregated data, That's what the speaker with our honorable members were discussing. So in your opinion, maybe this is one of the challenge that because we haven't seen throughout the presentation, the disaggregated data for us to know what are the services that needs to be implemented, especially when it comes to the marginalized group. So probably maybe you can provide us some response in relation to that one. Thank you.
Yeah, thank you very much. I think what the assessment tried to understand is how are we prepared to ensure that marginalized group of people access SRHR services should an emergency occur. So we looked at different level, the accessibility, the information, the language, and so forth. So we have collected data for every country. The presentation I made is a compilation of the 2 regions, but we have the data for each country where we can see how where the issues are in a more detailed manner. But when it comes to what type of services they need to access, actually they need to access all the package of services that it should be availed to everybody. So in a spirit of leaving no one behind, they shouldn't face or miss or have difficulties to enjoy the rights to access every type of SRHR services that are available to other people who are not having that issue of disability. So what I would recommend is to revisit the way we design our services, the way we design our preparedness plan to ensure that we have in mind those left behind, the marginalized group of population, including the people with disability, to ensure that they have access to information. As one of the honorable ones just mentioned, that the information communities need to know what to expect and where to expect or to reach to benefit from these services, where they are. We need to have in mind that there are some people who have disabilities who may be challenged to access them and take action accordingly. I don't know if I addressed your question, but that's how I can address it. And happy to continue engage. Thanks.
Thank you so much, Mr. Gabriel. I think you have provided the essentials of the questions that have been asked. May I put go back to the floor? Any other issues or any questions? Yes, please. Yes, please. DRC.
Oui, la RDC, merci. C'est l'honorable Kazadi Gabriel. Madame la Présidente, à suivre l'intervention de notre orateur, moi je crois que nous avons l'obligation de préparer le système de santé au choc. Depuis l'apparition de maladies saisonnières jusqu'aux pandémies et voire même catastrophes climatiques. Même s'il faut faire des recommandations, je crois que nous devons les fonder sur les enseignements tirés lors des gestions de risques et des situations d'urgence. Qu'il s'agisse de réagir à des épidémies de choléra provoquées par des inondations, de soigner les victimes des séismes, les systèmes de santé jouent un rôle primordial dans la limitation des maladies et des décès résultant des urgences. Est-ce que nos pays peuvent avoir la capacité à fournir des soins essentiels fiables en cas d'urgence pour protéger le bien-être de la population? Je ne pense pas. Peut-être surtout avec le pays à faible revenu ou à manque de moyens, je crois que les situations qui sont provoquées lorsque des services de santé sont surchargés et fragiles sont désorganisés à la suite des catastrophes. Les conséquences peuvent compromettre les acquis du développement humain pendant les décennies et leurs effets se répercutent souvent au sein des populations et d'une génération à une autre. Mais qu'à cela ne tienne, nous avons peut-être pensé faire des petites recommandations si l'intervenant peut en tenir compte. Ne pas dire comme recommandation, c'est améliorer des canaux de communication. C'est d'abord une priorité, puisque s'il n'y a pas de communication de la base au sommet, je crois que les efforts qui peuvent être entrepris n'auront pas de succès. Ensuite, nous devons faire une approche fondée sur les données pour une prestation de services coordonnés. S'il n'y a pas d'approche qui est fondée sur les données fiables qui sont récoltées sur le terrain, je crois qu'on ne saura pas ou on ne sera pas à mesure d'arriver à y apporter une riposte égale à la conséquence que nous subissons. Et enfin, si les systèmes de santé peuvent anticiper les contraintes en matière de ressources et surtout disposer un plan d'urgence pour les approvisionnements critiques, je crois que de cette manière-là, on aura fait quelque chose. Et enfin, préparer nos filles, préparer les filles et les personnes vivant ou les personnes vulnérables à tenir compte de leur avenir. Voilà, Honorable Présidente, quelques recommandations qui, en principe, peuvent être appliquées. Mais de l'autre côté, au niveau de la RDC, je crois que nous avons fait un pas d'avance, parce que récemment, là, nous avons adopté une loi qui sera promulguée par le président, en ce qui concerne la couverture universelle de la santé. C'est-à-dire, dans cette loi, nous avons essayé de planifier les plans d'intervention rapide en cas de catastrophe. Par exemple, tant que nous sommes ici, vous avez suivi qu'il y a eu des pluies diluviennes qui ont fait 400 morts dans la région de l'Est, là où il y a la guerre du côté Goma. Et toutes ces choses-là, d'un côté, il y a la guerre, et les attaques de la rébellion, de l'autre côté, il y a une catastrophe naturelle, et même les services de santé ont difficile à intervenir. C'est-à-dire comment coordonner les choses. D'un côté, il y a la rébellion qui bloque le passage. Bon, les partenaires qui sont sur le terrain et aussi débordés, des fois, ils ont peur d'intervenir parce que les rebelles sont dehors de la loi. Ils ne savent pas effectivement respecter le convoi humanitaire pour intervenir lorsqu'il y a des catastrophes pareilles. Voilà en quelques mots, Madame et Honorable Présidente, que j'ai voulu peut-être apporter comme petite contribution auprès de l'intervention de tout à l'heure. Merci.
Thank you, DRC. I presume there were some issues that you discussed were already included into the presentation. Say, for example, the access to services, communication, and institutionalization of the program into the curriculum. But still, I will go back to Mr. Gabariri to provide his input in relations to access to services and communication. Thank you. Hello.
Yes, thank you very much. I think Honorable has really elaborated very well on these points. The communication during emergencies is very key, and access to services. I can not overemphasize it. It's really very key. And we should ensure that we include some of the activities in this costed preparedness plan. Here, I want to emphasize the costed preparedness plans and put aside the resources to actually action those plans. Because as one of the honorables said, it doesn't make a difference if you make plans without putting aside the resources to be able to implement those plans when times comes. And in the region, we are quite more or less sure when this time is coming, because we have these seasonal emergencies coming, and of course, complicated with conflicts like our colleague from DRC has mentioned. So this communication, the channel of communication and collaboration between the health system and emergency disaster preparedness and response management authority need to be enhanced and need to happen throughout the preparedness, the response, the recovery phases, so that we ensure that we capture lesson that we apply in the next, event upcoming, so that we respond better, we prepare better as we move along. Otherwise, all the important elements that he mentioned are very valid. And also, as countries are moving toward universal health coverage, we want to see barrier to access being alleviated with time. Being physical access, being financial access to services need to happen during the stable time, so that when emergencies occur, we have already SRHR services which are already easily accessible. And this will help the health system not to be overwhelmed. Because we have learned lesson from COVID, we need to further strengthen our health system to be ready to absorb shock when emergencies occur. Thank you.
So I believe DRC, your question has been answered. Thank you. Any other comments? Yes, DRC.
Je voulais seulement dire merci à l'intervenant parce qu'il a essayé d'apporter un plus.
Okay. So I don't know if are we going English, French, Portuguese, whatever. Maybe in Portuguese, né? I think it's better. Sim, então, eu também quero agradecer esta oportunidade, dizer que como substituto da minha colega é a primeira vez que eu participo. Estou um bocadinho perdido, mas estou a tentar me reencontrar. E a minha questão é a seguinte, um pouco também para servir talvez de recomendação, uma análise e também depois uma recomendação. É que um dos problemas que nós temos vivido em África, de forma geral, talvez em particular aqui na nossa região, mas um problema geral de África, é talvez a falta de previsibilidade das questões, dos assuntos. Os desastres são coisas que vão acontecendo continuamente, mas o que temos constatado é que as ações que os governos tomam são sempre num quadro de muita emergência, como se não soubéssemos que isso iria acontecer. E o que é que resulta isso? Estamos sempre a dizer que é algo emergencial, tá bem, mas nós já sabemos que as mudanças climáticas vão acontecendo, que o aquecimento global está em curso, e as chuvas, as secas, repetem-se. Não há nenhum ano em que num país qualquer em África ou aqui na nossa região, não há estes casos. Então, não há nada de novo. E é por isso que quando estamos a falar de coisas de emergência, sim, mas também são coisas que nós sabemos já que podem acontecer. Pronto, se não acontecerem, ainda bem, mas a probabilidade de acontecerem é muito grande. Então, a experiência que as pessoas vão tendo, por que não é aplicada para podermos prever ou então já organizarmos logísticas que possam permitir que esses assuntos, quando surgirem, possam ser mitigados. Qual é a minha proposta, a minha recomendação? Vendo os exemplos que o nosso preletor deu sobre Angola, o Lesoto, o Burundi, a RDC, que tem já alguns organismos permanentes, eu iria mesmo recomendar que, se fosse adotado, talvez a necessidade dos nossos governos criarem mesmo, lá onde não há, mas uma espécie de ministérios de gestão de desastres, porque é permanente, para que estes estejam a estudar também de forma permanente os vários casos que aconteçam nos diferentes países e que possamos sempre juntos partilharmos essas experiências, pronto, embora são mais, mas são experiências, para que então a mitigação, a resolução ou a abordagem desses problemas então tenha já algum background, tenha alguma base, e não agirmos sempre só na perspectiva da emergência. Pronto, choveu hoje aqui, então emergência, mas há casos muito práticos. Então, eu acho que, havendo uma espécie, lá onde há institutos, em outros pontos, acho que estão a me ouvir, em outros pontos há comissões, como em Angola, se passarmos para ministérios mesmo, e esses estejam a estudar de forma permanente, então, estas situações. Era esta a recomendação que eu queria fazer. Muito obrigado.
Thank you. We've been hearing you loud and clear, no problem. Now it's coming back, the lights. Thank you so much. Mr. Gabarere, the main issues discussed here is what do you think of the proactiveness, or I should say reactiveness of countries in response to emergency preparedness rather than being proactive? And then, of course, you put forward a recommendation, Angola, in relation to the creation of at least a body or an agency to respond to natural disaster management. But I probably the proactiveness and the reactiveness, which I shall put forward to Mr. Gabiriri to provide us with his opinion about this issue.
Yeah. Yeah, thank you very much. Regarding the proactiveness, how countries should be really very proactive, I think we covered it in the assessment. And if I want to reiterate the quote from the DRC colleague, he said that we are always reactive instead of being proactive and enhance our preparedness. So I think countries, we should using evidence around the cost effectiveness of better preparation vis-a-vis to response, which is not informed by enough preparation, because there is saving that you make when you deploy a response that is informed by a very strong preparation vis-a-vis to when you react to an emergencies and start to put together a response afterwards. So we need to come up with evidence and the policy brief based on informed by those evidence on the cost effectiveness of investing in preparedness rather than in reactive emergency responses, and use those to initiate conversation with the policymakers, the decision makers in our respective countries and region to ensure that there is a buy-in to invest more in preparedness rather than always running up and down when the crisis comes. So I think that's what I can say about this. I think we all have a homework to put together our hands to provide those evidences and share them and initiate advocacy across different levels of decision makers. Thank you.
Gaberere, for the response, I presume Angola has managed to. Thank you. The next one from South Africa, our host.
Thank you very much, Madam Chair. And I want to also welcome the presentation and further agree with all the speakers who spoke before me. My contribution on this matter, Chair, is that it's important that as we plan, we plan accordingly, because my view is that proper planning prevents poor performance. if we can properly plan, it will actually assist us in preventing a poor performance. Given the fact that if we plan properly, we'll be able to avoid a problem where you find yourself as government and running around when there are issues of disaster and all that. For an example, in most cases, Chair, Madam Chair, you will agree with me that those that are marginalized, the communities that are marginalized are the most affected ones. And climate change, in most cases, affect those communities, the marginalized ones, including our women, refugees, and the indigenous people. And we need to have, as this presidium, as this collective, we need to put systems in place. Our laws must be able to respond to such challenges, and it must be in place. Our laws must be able to respond, Chair, to those issues that we confront ourselves with, including our policies. Because if we have got a policy in place that is running and all that, we'll be able to respond to those issues. Those were my contribution, Chair. But lastly, my suggestion to you, Chair, is that I think if there are questions, we take questions, everything, and then we allow the presenter to come in rather than coming in, and then we allow the presenter, then the other speaker comes in and all that. So my view is that let's allow all of us to contribute, and then at the end we allow the presenter to respond. That's my view, Chairperson. I'm not trying to intrude in your role as a Chairperson, but it's my suggestion. Thank you.
Thank you. Thank you, South Africa. If it's agreeable by the committee, it's fine with me. I don't have any problem. So agreeable. So, okay, we have taken your points, Mr. Gaberere. So we'll take more questions from the floor and then we'll come back to you. For any more questions or clarifications from the floor? Yes, from Namibia, is it?
Yes.
Namibia and then
Yes.
Madagascar.
Thank you. Yeah, thank you, Honorable Chairperson. Thank you, Mr. Presenter, for your well-researched information. I think you mentioned that there are countries where we have the national policies, national emergency policies in place. But however, they might be just collecting dust somewhere under our tables. I don't know what recommendations that you can put to the House so that at least with our nice crafted policies in place, they should be put to use. So I just want that clarity. And I hope for the time, maybe you will not be able to indicate as to which could be the countries that are really lagging behind that need to be pushed to come to a level where we can say that as time goes, at least they will improve on their policies in place, and those who do not have policies in place, what is our recommendations so that at least we are all at the same level of understanding, rather than we come to such important meetings, we make common recommendations, but at the end of the day, after 2, 3, 4 years, we are here again saying that, yes, we have policies in place, but no implementation. What actions can be taken. I know we cannot impose too much on our policies, domestic policies, but at least at a certain level that we can say, even though we are not fulfilling the whole package of what we are supposed to do, at least we have done even a quarter of what is expected of us. I thank you, Honorable Chairperson.
Maybe, may we go to Madagascar? Thank you.
Merci, Madame la Présidente, de m'avoir donné la parole. Et je suis d'accord avec notre collègue qui apprécie vraiment la présentation de l'intervenant. C'est la première fois ici que j'entends les MISP. Donc, c'est une nouvelle approche qui est vraiment intéressante. Et ça parle surtout de la situation d'urgence. Donc, pour nous, en tant qu'île, nous faisons partie des victimes de la catastrophe cyclique. Donc, c'est vraiment important de bien adopter cette approche. Et là, la collaboration entre le ministère de la Santé et les branches, le secrétaire exécutif de la gestion des risques et des catastrophes sont vraiment indispensables. Et cela implique une élaboration de plans d'action qui est vraiment nécessaire et avec les moyens différents. Donc, je vois que, comme l'honorable tout à l'heure a dit qu'il y a des niveaux qui sont déjà avancés, mais nous sommes vraiment intéressés par cette nouvelle approche. Et les objectifs sont bien stipulés, les 6 objectifs. Et pendant les catastrophes et le fléau, il y a beaucoup de risques, surtout dans le groupe vulnérable. Donc, il est vraiment important d'intégrer cette MISP dans le système de santé. Et là, je vais avoir des éclaircissements pour mieux intégrer ça dans le système de santé qui correspondent à notre pays. Et à la fin, je crois qu'après cet éclaircissement, nous pouvons bien stipuler le politique MISP et HSDSP. Et là, ça nécessite aussi des lois qui mettent en place le système, surtout en cas d'urgence et de catastrophe. C'est ça. Il faut commencer toujours par l'appropriation et la capacité de voir les SDSR et les MSP. Enfin, qu'on va aller dans la phase de préparation et de prévention, pas seulement sur les réponses en cas d'urgence. Merci.
Thank you, Madagascar. Any other hands so that we can move ahead? Any other questions or clarifications? No, if not, then we go to Mr. Gaberere. In relations from South Africa, he wanted to know, well, he talks about proper planning, so for effective implementation of strategies. Maybe you can provide in response to that. And it talks about the laws. In fact, during the presentation, he mentioned about there are so many, well, a number of countries that do not have laws and regulations, a conducive environment for implementation of such a plan. From Namibia, he recommended the use of plans and policies in place. And I know during your presentation, you mentioned about half of the countries. I don't know whether they were in the SADC region or within the African region, do not have a plan, emergency preparedness plan in place. And probably with the question coming up from the recommendations from Namibia, maybe we should maybe provide us an insight whether all the countries within the SADC region, they have a plan, they are implementing the plan, and just for us to know so that once we go back home, we shall be able to discuss with our other members of the parliaments and even our country's policymakers. And from Madagascar, in relations to, would I like to know what are the mainstreaming system that exists, or mainstreaming of preparedness plan into the health system, how effective it will help the population. And from my part, I would like to ask Mr. Gaberere. Okay, we've talked about how many SADC countries have already implemented the strategies effectively. And secondly, you haven't spoken about the availability of qualitative or quality commodities into those areas that you assessed. Were there commodities you mentioned about the resources, probably human resources, but materials you did not mention much, and even especially when it comes to quality commodities. And I would like to know as well whether or how effective or how acceptable were the policies accepted by the policymakers in our countries or in different countries to incorporate the MISP or emergency plan into the national health plan. I mean, were they very acceptable? It was not that acceptable, especially when it comes to access to services to the marginalized group. Thank you, Mr. Gabriel. Maybe you will respond to those few issues and provide us with your insight on it, opinion. Thank you.
Yeah, thank you very much for this very insightful and good questions. From South Africa, you mentioned on implementation, policies and law. And I will agree with him that it is really important to have both in place. And you will recall that most of the time we face issue regarding reproductive health law, which in some of the countries does not allow all the young women, adolescents to access sexual reproductive health services. In some countries, without they require parental or guardian consent. So this shows, and this is one of the barriers that impede the access to sexual reproductive health to adolescent women, young people. So this shows how policies should be backed by the law. And I would really agree. I can't agree more on that. And this is something that I think you parliamentarian, you have a big role to play to ensure that the law are friendly to SRHR services and they ensure access during the stable time and during emergencies. And this will only happen when this MISP is integrated into the policies, SRH policies, and into the disaster preparedness plans, and adequate resources are allocated to this. So for Namibia, he asked an important question: how do we ensure that our policies and strategy are not just getting some dust and not put on use? What I would say that we should normally have a monitoring plan. How do we monitor the implementation of policies and the preparedness plan. Actually, in the preparedness plan, we do include monitoring actions that should be part of that plan, including drills, to make sure that everyone knows who is doing what in terms of emergency. We simulate emergencies and we see if everyone is ready. And this should be part of the preparedness plan and operationalize before an emergency occur, so that we make sure that we are ready and we address the bottlenecks that are being revealed during the exercise. So by putting a strong mechanism, monitoring mechanism in place, I think every country will be able to check and ensure that the policies are being put on use and not only collecting dust. So regarding what are the countries lagging behind, we do have a database that includes all the countries. For the sake of this presentation, because it is a regional SADC meeting, we couldn't go into detail for each country, but we do have information for every country. And each country team developed an action plan. They have the information. So I think every country has the information, but if need be, we can, again, we share the information with you so that you know every country, where each country stands vis-a-vis to different indicators that we are interested in this assessment. So we need to have the information and monitor. And of course, as I said, every country developed an action plan that they are implementing. We have been able to support 5 countries to provide some catalytic fund to champion this implementation of action plan. But other countries as well are implementing action plan using their regular or their means. And we are planning to have a knowledge sharing meeting in June, early June, to see how the country stands in terms of the progress of implementing these plans. So to do is to make sure that these 2 entities talk to each other, because most of the time you see this silo kind of work happening, and it undermines the potential of working together between the 2 entities, the 2 institutions. So we should advocate and make sure that MOH, Minister of Health, and the Minister of Disaster Management work together during the preparedness, response, and the recovery phases. So we shall, using that approach, we shall ensure that we have an effective response should an emergency occur. So we should put some of the action in action plan, some of the activity aiming at enhancing that collaboration between the 2 main players of emergency response. So how do we mainstream this in the health system? So during the development phase, we are looking at health system strengthening, universal health coverage, which should include sexual reproductive health and rights services. This should be part of the universal health coverage. This means a package of services that should be easily accessible to every citizen, accessible financially, accessible geographically. So that's what we should aim for during emergencies. So during development or stable times, during emergencies, we should ensure that we have included already the MISP into preparedness plans, so that people affected are able to access these SRHR services. But as you have seen, the objective number 6 of the MISP is to integrate the MISP into a broader sexual reproductive health, a comprehensive package of services, which is provided by the primary health care, the existing health system. We should aim to integrate so that we don't dwell long time for the minimum, but we aim to integrate and provide the comprehensive service package. And this shows how the humanitarian response should contribute to health system strengthening. And this, again, underscore how our humanitarian work should work in a vision to enhance humanitarian development and peace nexus. So the objective number 6 of the MISP really speaks to this need to enhance or strengthen the health system to ensure that we don't delay or take much time providing the MISP, but we should integrate into the existing system because to help the whole system to learn and to be resilient enough to absorb any demand that comes with emergencies. So, yeah, I have talked about the law and SRH policies and ownership. The ownership capacity to take into account the need of vulnerable women and girls during emergencies. This ownership should happen at all levels, and we should make sure that all levels, including the communities, they are aware, they are conversant with these services, where they are, their rights, where that they need to access these services and to seek for these services when emergencies occur. So this level of ownership should happen at all levels to ensure that we have a collective efforts to expand and accelerate the universal access to SRHR, being during the time of emergencies or during stable time, as we further strengthen our system to ensure the system are resilient enough to address the need that occur during emergencies. Regarding commodities, I did not go into details about commodities, but MISP address also the commodities. Every objective of MISP is linked to what we call reproductive health kits, which include the reproductive health kits, the commodities that are needed. So when we work with countries to enhance MISP integration and MISP preparedness, we make sure that also these commodities are readily available. And one of the important strategies that we are looking to enhance or to promote is the prepositioning of commodities to ensure that when emergencies occur, the commodities are already, the supplies are already available to ensure that the services could continue. Because we have a saying that without supplies, without commodities, there is no program. So we need to make sure that these are happening, and we collaborate with the government and the other partners, and UNFPA is the lead organization when it comes to this reproductive commodities and supplies during emergencies. So the country offices, which country work collaboratively with UNFPA to ensure that these supplies are in place so that they are ready to address the emergencies. How acceptable were policies or will the government's welcoming the proposal of integrating MISP into policies? We have seen really a good, positive interest, a positive response from the government. And as we have been providing some court examples in my presentation, like in DRC, they have already started to integrate the policies, MISP into some policies. We are working with 5 countries to develop vulnerability assessment tools that we help also to further inform the preparedness actions, including identifying the vulnerable group of people who we need more attention during the preparedness so that when emergencies come, they are catered for. So countries are really very positively responding to this initiative, and we would count on your advocacy, your collaboration and support to make sure that we keep the momentum and we make sure that the action plans are very well implemented, and these issues and countries that are lagging behind address the issues at policy level and at service delivery level to ensure that we are very well prepared when it comes to addressing the SRH needs during emergencies, including MISP. So those are a few things that I can share with you, but we remain open and available to address any other question or comments, be it during this meeting or further engagement that we can organize. Thank you. Over to you, Chair.
Thank you, Mr. Gabriele. Thank you so much for the detailed presentation that you presented. It was very informative. And we are hoping that we shall be looking forward for other presentations. Like you mentioned, you've been working with 5 different countries in regards to vulnerability assessment to support them. And we hope that in the near future, we shall be able to have you again on our arena to support us with the provision of evidence-based information in relation to sexual reproductive health, not only in emergency preparedness plan, but in other situations or in other strategies, especially when it comes to the support countries to implement the Maputo Declaration for us to achieve universal health coverage by the year 2030. Thank you so much. A big applause for Mr. Gabriele from the floor. Thank you so much.
It's my pleasure. Thank you. Thank you, Chair.
Thank you. So now we are concluding the session of this afternoon. I have the honor to hand over the Vice Chairperson of the committee, HSDSP, Honorable Kasim G.S. Haji, to deliver the closing remark. Honorable Kasim. Oh, you are fine?
Thank you, the Chairperson of Standard Committee, dignified honorable members here present, representative from the SADC PF Secretary, ladies and gentlemen. I would like to take this opportunity to acknowledge the Honorable Chairperson of HSDSP, Honorable Her Excellency, rise for the leadership and expertise she has always showcased at each stage, and a milestone in this committee as its M4. As we wrap of this fruit day, I'm one to appoint that adopted the great statesman Jomo Kenyatta was right when he observed that you and I must work together to develop our country, to get education of our children, to have a doctor, to build a road, to improve or provide all days today's essential. I must add this admotion was a backing on all of us here today join hands, put shoulder to the hill and the pose agenda of the equitable, inclusive, sustainable human centered social economic development of our SADC region. It is in that spirit that I take this opportunity to extend my sincere gratitude to your honorable member for your incisive question, impatient deliberations, and obtain resolution. It is my claim to call and fervent help that you maintain this momentum as we go into joint sitting and subsequent. When we return to our home country, may I also cover my profound appreciation to the SADC PF Secretary under the able to leader of HEB, Seguma, for their usual process in organizations such as engagements. Finally, I will express my gratitude to the resource person from the SAT and the UNFPA who took their time to share their knowledge with us going forward. Let us to take this invaluable lesson to learn today and use our constitutional mandate to ensure that the goal we have set to be achieved in our home country. With those few remarks, allow me to officially close this meeting as I wish you a pleasant working week here in Johannesburg. Thank you.
Gone forever, but I don't think it will come back. Anyhow, now we are concluding the session, but beforehand, I would like to thank Mr. Sofo, our research SADC officer, a research of the SADC officer who has been assisting us, and he is our new research officer for the committee. Am I right? And may I now have the honor to thank you all for your very patience during the meetings and your commitment, especially the questions that were raised, the different recommendations that were put forward in relation to the topic brought forward by Mr. Gabereri, and hope the SADC Secretariat has taken note of all the recommendations that we have brought forward, and hope it will be sort of implemented by the member states based on the, like I mentioned beforehand, based on the availability and especially the funds, resources, and so on. So thank you so much for your attendance. Now there's, I don't know whether we can go around or maybe we can't because of the lights. In any other business that members would like to discuss, or we can close the meeting. We can't even see each other. Any other business? If not, the meeting is now adjourned. Thank you very much. Thank you. Thank you.